My name is Dr. Pape, and I have been asked to share some background information with you and describe this evidence-based practice to reduce medication errors and risk to the organization. I invented these practices and published my study results in 2002. I coined the practice the MedSafe Protocol. I have voluntarily helped thousands of organizations implement these practices, thus reducing medication errors, patient injuries or deaths, and the resulting liability to the organization. Another company patented the vest before I got a chance to do so. Still, as a professional, my intention is to help organizations reduce risk by sharing a successful implementation process. The leading cause of medication errors is still the result of interruptions and distractions. Other causes include lack of focus, lack of medication knowledge, and failure to follow protocols. Many errors result when human performance limits are exceeded, plus the ability to maintain vigilance and keep one's focus in the presence of excessive stimulation is very difficult. Attention requires concentrating on one thing while ignoring other things in the environment. The work of medication administration requires using both the primary and working memory while maintaining one's attention, focus, and concentration. When distractions and interruptions occur, the ability to maintain attention declines dramatically. Today, nurses are typically not given much respect for the difficult job they do, but they tend to overestimate their own abilities and think that multitasking is easy, but underestimate their limitations in doing so. Nurses are naturally empathetic, which leads them to allow people to interrupt them sometimes at the worst possible time. Simply because nurses are standing still at a medication dispensing machine, they are often prime targets for interruptions. It has been shown that nurses who are better educated about the importance and effects of human factors in their work are better able to anticipate and guard against interruptions and errors. But nurses need proven methods they can use to prevent interruptions and distractions during medication administration. Culture includes relations between individuals, groups, and positions that help shape the way the work is done and how processes are changed. The organization's culture of innovation and change can affect error reduction. Each organization's culture for how interruptions during medication administrations are handled affects whether or not anyone takes actions to prevent them. If interruptions and distractions during medication rounding continue to be accepted by nurse leaders, then risks will prevail. Leaders should help nurses feel empowered to not accept the status quo, but to prevent interruptions and distractions during medication rounding. Most nurses tend to accept their working conditions from overwork and fatigue, even when they complain about all the interruptions. Some feel inadequate to demand anything different. Many nurses say that they are considered incompetent if they find it hard to work with constant interruptions. These attitudes need to change. So, the MedSafe protocol includes 1. Donning the vest attire, 2. Using a standard protocol for medication administration. The checklist I invented is based on standard practices that are taught in nursing school, but they may forget. 3. Identifying a safe zone for medication setup where nurses are not interrupted or distracted. Mark off the area if there is no doors to the medication room. 4. Placing Do Not Disturb signs in all medication areas. 5. Avoiding conversation and reducing noise during medication rounding. 6. Educating staff and using teamwork. 7. Educating patients regarding the meaning and importance of the vest. More information can be found on the AHRQ Innovation Exchange. The vest is put on in the medication room or area for medication retrieval, and worn only during the process and not between medication passes. The nurse is not to engage in conversation with anyone unless it is related to medication delivery. Avoid eye contact with others during rounds. Some nurses actually cause their own interruptions by making eye contact with everyone they pass. The process allows the nurse to not be interrupted while giving medication. It is best to write some identifying initial on the vest to identify it so it can be used for other medication rounds that day. Discard this disposable vest if it becomes soiled or contaminated. A team strategy is best to start implementing the MedSafe protocol. The following roles help with the initial and ongoing implementation. Choose a project manager. This should be a highly skilled and respected person with the ability, willingness, patience, dedication, and positive energy to manage and control the implementation. The team. You will need support from the nursing staff. A nurse or nurses on each unit that are committed to this project. Give them a title such as Unit Champion. Titles often help with motivation. They will provide initial and ongoing training to nurses. A quality analyst. Choose an analyst from the quality department to organize and support the collection of metrics and to measure the success of the implementation and ongoing improvement. Resistance is an inevitable, not logical, emotional response to some changes, whether they are viewed as positive or negative. Resistance often comes because of not feeling included in the change process. Resistance is good when it surfaces problems, finds errors, or makes a good idea better, when it is overt or spoken. But resistance is bad when it is covert or intended to sabotage the process or be malicious with non-compliance. But, believe it or not, resistance is manageable. One method to prevent resistance is to plan for it. This can be done by including others in planning and implementation of the change. Remind nurses that the intent of wearing the vest for patient safety, the reduction of risks associated with errors. One hospital manager frequently told nurses, "We are not here to look cute in our uniforms. We are here for the patient's benefit. So wearing something on our uniform is only for a short time. The end result will be reduced liability and costs for the organization." I recommend starting with one nursing unit to reduce confusion. On the first week, review the entire process with every shift at the start of shift change. Conduct at least 2 to 3 simulations during the first week of implementation. Peer-to-peer training is an excellent option if you have early adopters and process champions readily available. Nurses who have achieved success often have tips, tricks, and other ideas to offer other nurses. For example, how to handle persistent interruptions and avoiding eye contact. One hospital had a nurse hand out the vest to other nurses. The nurse reviewed the process and then placed the vest on each nurse in line. It created a wonderful sense of induction and ownership in the process. During weeks 2 to 4, review the entire processes each shift again. There may be nurses who miss the initial week. To spread the word, you should ask to be placed on the meeting agenda of various groups, including the medical staff. Explain the importance of the process and the risk that is reduced. Add the medication safety information to your patient information packets and verbally orientate patients to the process when they are admitted to the unit. Some lessons learned from implementation are that transitioning to new practices takes time and patience. Negative emotions about the change will improve along with practicing the change. People do tend to go back to old ways of doing things when the pressure is off, and they are expected to act on their own. Champions can help with maintaining momentum. Sustain the new practice and keep reminding everyone of the purposes of the new protocol. Reducing errors. One way to do this is to celebrate successes. to have reward systems built in for those units who have made the most progress in reducing interruptions and distractions and errors. Reward the early adopters first and let them know what a difference it is they are making in reducing distractions, medication errors, and risk. Let them know that a side benefit is improved nurse and patient satisfaction, as nurses find more time for their tasks and patients get their medications on time. Thank you for your attention and for your efforts at saving lives.